The tonsils are two round bulbs of tissue that sit at the back of the throat on each side. They make up part of our body's immune system. Our immune system helps fight off infection and keep us healthy. Tonsillitis is when these lumps of tissue become infected. Common symptoms of tonsillitis include a sore throat, difficulty or painful swallowing, a temperature of 38 degrees or higher, a cough, a headache, a stomachache or feeling sick, tiredness, and even earache. Your child's tonsils can look red and swollen, and you may even be covered in white spots. You might feel tender, swollen glands in the front of your child's neck. These are called lymph nodes and can often get bigger during an infection. They're a sign that your child's body is fighting the illness. Tonsillitis is very common in children and teenagers and is usually caused by viruses like the cold and flu. It can also be caused by bacterial infections, but this is less common. Signs that suggest a bacterial cause include a temperature of 38 degrees or higher, red, swollen, inflamed tonsils, white, pus-filled spots on the tonsils, swollen glands in the neck, and having no cough. The more of these signs that your child has, the greater the chance they have a bacterial infection that might need treatment with antibiotics. Whatever the cause, tonsillitis usually lasts for around 1 week, and most children will start to feel better before this time. Most cases of tonsillitis can be easily managed at home. Make sure your child gets plenty of rest to help them recover. Give your child regular paracetamol and ibuprofen to help with pain and bring down a fever. Make sure you give your child plenty of fluids. Children might be reluctant to eat or drink when they have a sore throat, and this can lead to them getting dehydrated. Cool drinks or warm honey and lemon water can also help to soothe the sore throat. Most cases of tonsillitis are actually caused by viruses, which antibiotics don't work against. Evidence shows that taking antibiotics only reduces symptoms by about 16 hours compared to not taking them. It's not a good idea for your child to take antibiotics unless they really need them. Antibiotics can do more harm than good, giving your child uncomfortable side effects like stomachache, diarrhea, and skin rashes. Taking antibiotics gets rid of the normal healthy bacteria that protect us every day. Clearing this good bacteria can lead to more infections like thrush. Taking antibiotics can make bacteria resistant to them, meaning antibiotics won't be able to kill the bacteria anymore. The more antibiotics you take, the worse this gets. Tonsillitis is very common, and the majority of children won't need their tonsils taken out. Your GP might suggest having your child's tonsils removed if they suffer from repeated, severe infections that are affecting their normal daily life, such as having to take many days off school. Speak to your GP to see if your child is eligible for referral. The cold and flu viruses that cause tonsillitis can be passed on by coughing and sneezing infected droplets into the air. You can reduce the spread of these bugs with simple hygiene measures. Catch any coughs and sneezes in a tissue and throw it away. And make sure you're washing your hands regularly, especially after coughing and sneezing. Contact your GP if your child's symptoms don't start to improve after 3 to 4 days. Contact your GP if the pain is making it difficult to eat. And contact your GP if your child has severe symptoms. Seek urgent help at the hospital if your child develops a swelling on one side of the throat. If your child has difficulty breathing, if your child has difficulty swallowing saliva or liquid, or if your child has difficulty speaking or opening their mouth. These signs suggest an abscess on the tonsils, also known as a quinsy, which requires urgent treatment at the hospital with antibiotics and drainage. This is quite a rare complication of tonsillitis. Speak to your pharmacist or GP for advice on how to manage tonsillitis. Head over to the NHS Choices website for more information on tonsillitis and seeking further help.